I just figured something out this month and I want to share it with you. I have been treating alcohol the wrong way from a prevention lens, completely wrong way. My name is Karla Caldwell. I am a nurse health coach and the leader of the whole life healing movement. And every year for the past 8 years, I facilitate a discussion called Limit Alcohol. And the discussion is for interdisciplinary clinicians so that we can talk about. I share different evidence based communication skills to support having the sensitive conversation of alcohol with patients. It is a sensitive conversation and tools, but the focus is on assessing patients and those who are in crisis getting care. So that's one thing that I realized this month. Wow, we're waiting till it's too late. That's reactionary. That's not preventative. And the other thing that caught my attention is we treat alcohol like it's a patient problem, a patient opportunity, not a staff opportunity. And I now believe that we need to have a discussion regarding alcohol with everybody, with both staff and patients and ourselves. If we were to ask ourselves, what would it look like to be preventative? That's what I sat with, is instead of helping people with alcohol when they're in crisis, what would it look like to be preventative? And what would it look like for everyone to have this discussion? For you, for me, for healthcare staff, and for patients. And what I thought is, what if we asked, what is your relationship to alcohol? That's very different. It's not about me telling you what to do or how much. It's just a curiosity question of, what is your relationship to alcohol? And I've been thinking about that the last 2 weeks. What is my relationship to alcohol? And what I've noticed is that throughout my life, it's fluctuated and it's more than how many drinks did I have in a week. It's about, how do I treat alcohol? And the follow-up question that I'm really excited about is, do you ever consume alcohol to manage stress or any other emotion? Oh my gosh. So think about that. Think about if we were to ask everyone, what's your relationship like to alcohol? That's a curiosity question. No right or wrong, just curiosity. And then, do you ever consume alcohol to manage stress or any other emotion? Wow. When I thought about that, I thought sometimes. And when I brought these questions up in that discussion I lead, it was really interesting because all of the clinicians in the virtual room now started thinking about their own relationship. And do they ever consume alcohol to manage stress or any other emotion? I feel like it was, the question really got people to think. It's gotten me to think about things. And so now, instead of focusing on how many drinks and drink less and basically telling, we're inviting someone to be the expert of themselves and to be curious about their behaviors. And if someone does consume alcohol to manage stress or any other emotion, that opens the door to another question, which is an invitation to, are you willing to notice when you're about to consume alcohol to manage stress or a different emotion? And are you willing to replace it with something different? Is it okay if I share why this matters? And the reason it matters is because if we are consuming alcohol to manage stress or a different emotion, we're just one life situation away from abusing alcohol if we have made it a habit to use it to manage stress or different emotions. So instead of me telling someone the dangers of alcohol and overconsumption, if I start to initiate a conversation about what could you do different, and can we help you manage your stress in a different way that doesn't have side effects, that there's no danger of becoming dependent or overconsumption if life gets in the way. Are you open to building your managed stress toolbox? Isn't that so cool? I just got so excited. I thought, wow, this is so different. And now we can start talking about what do you do to manage your stress? What other things work for you that have nothing to do with alcohol, or I would add food, because food can be used. Emotional eating. That's what emotional eating is all about, is eating to manage emotions or stress. So, what kinds of things have worked for you in the past? And if you already have things that work for you, fantastic. Are you willing to write it out so that it's actually in your journal or somewhere where you can look at my Managed Stress Toolbox? I actually have one of those, and what it looks like is I have it in my journal because I like to bring pen to paper, and I write all the things that help me manage my stress so that I have choices. Because in the moment, I need choices. And in the moment that I'm stressed and want to manage my emotion quickly with either food or alcohol, I now have a reference. And I can remind myself, oh, that's right. I have that playlist of feel good songs. I like going out in nature. Playing with my dog makes me feel good. Meditation, breathing. I like the following breathing techniques. They're really helpful. I have that YouTube playlist for different meditations. I'm just sharing the things that are in my toolbox. Your toolbox would look different than mine. Now, if you don't have anything, you haven't thought about this before, then that opens the door for me to say, is it okay if I suggest some things you might try? What matters is you finding what works for you. So today, I don't want to get as much into how do we introduce this with our patients. I wanted to make sure I talked to you about this. I wanted to present the idea that if you do consume alcohol, are you willing to look at your relationship? Is it a healthy relationship? Is it not healthy? Are there parts that you like about your relationship to alcohol? Are there ones that concern you? Are there things you don't like about it? Just from a curiosity mindset, not guilt, not shame, not I should or I would, just curiosity. And then collecting data from the most important place of all, you, and asking yourself, do I ever consume alcohol to manage stress or any other emotion? And if the answer is yes, am I willing to pay attention to when that happens and replace it with something different? I would also invite you to think about your managing stress toolbox and begin building it now before you need it. If we wait until we're in crisis, it's just not likely that we'll be able to cope using a managed stress toolbox. Managed stress toolboxes work preventatively. So I encourage you to document what are the things that help you manage your emotions, that help you manage stress, and document them in a way that makes sense for you. whether it's through audio, creating an audio note for yourself, or typing a document into your laptop, or writing pen to paper in your journal, whatever makes sense for you. And if you find your toolbox has 2 things or less, you want to start finding the things that work for you. Start practicing different things that have nothing to do with food or alcohol, so non-addictive things to support managing stress and managing emotions. You want to look at different forms of exercise, meditation, mindfulness, music, dancing. There's so many things. And what works best is what you like and what works best for you. I would love to know what you think about this. Have you ever thought about alcohol in this way? And if you are in healthcare, have you ever approached the conversation about alcohol with your patients in this way? I absolutely want to learn from you, and I want to hear your experience. If this was helpful, please share. Have a wonderful day. Thank you so much. And I invite you to become a whole life healing leader. If you are serious about healing yourself and role modeling that healing to everyone within your sphere of influence, consider becoming a part of this movement. I am rooting for your success times 1,000. Have a great day. Thank you.